Hello, my name's Rachel from Kendra Pilates. We're just going to do a little 5-minute video on breathing. So can we just find your sternum to start with? Can we just find your breastbone? So the breastbone's actually made up of, well, there's 3 bones. We've got a little kind of round bone at the top, the manubrium. And we've got a bigger bone down the centre, which is the sternum. And at the very bottom, I don't know if you can feel, but there's a tiny little bone called the xiphoid process. So if we can just start by trying to find that little xiphoid process. I'm just going to show you the sternum. So we've got the manubrium, then we've got the sternum coming down here, and this little bone at the bottom is just the xiphoid process. So can you find your xiphoid process? Might be a little bit tender. Diaphragm attaches onto the xiphoid process. And can you just notice if it does anything as you breathe? So if we just take a lovely deep, slow breath into our lungs, does that xiphoid process do anything? Does it move? So there's actually a joint between the xiphoid process and the sternum. And it's really minimal, the movement, but it's quite important. As you breathe in, the xiphoid process just comes forwards a little bit. And then as you breathe out, the xiphoid process comes back. So can we feel that? As you take a breath in, can you allow your xiphoid process just to swing forwards? And on the out breath, can it swing back? So xiphoid process swinging forwards on the in breath, swinging back on the out breath. Forwards on the in breath, back on the out breath. Like it's moving away from the back of your rib cage or moving away from your spine. So on the in breath, xiphoid process moves forwards, on the out breath comes back. Let's try one more like that. So xiphoid process forwards on the breath in, back on the breath out. So if you're not sure that you could feel that, maybe we can try the opposite. Can you imagine the xiphoid process coming back on the breath in? So can you let the xiphoid process come back towards the spine as you breathe in? And I can't really breathe if I do that. So let's go back to breathing in, xiphoid process forwards. Breathing out, xiphoid process back. Let's try that with arms down by our sides. So can we feel, can we image, can we imagine the xiphoid process, little bone at the base of the sternum just swinging forwards and backwards as you breathe. So there's a little joint, and it can get fused if it doesn't move. Those 2 bones could get stuck together. It's important that they move. We're going to start to tap our right lung. So I'm tapping my left, you're going to be tapping your right. So the lung comes right up under here, right up underneath your collarbone. It's like it just pokes up underneath your collarbone. So can we tap where the right lung is? Of course, we're not quite touching it. We're touching skin and subcutaneous tissue. And then we can feel that there's bones. But can you imagine that we're kind of essentially, we're tapping the lung. So we're getting right down to the lung underneath. So the lung comes right under here. Can we tap the back of the lung? And can you breathe into this right lung as you're tapping it? So our right lung has 3 lobes. It's like it's got 3 compartments. So as we breathe in, all 3 of those lobes expand, like 3 balloons. And then as we breathe out, they just shrink and they just relax. So can you see that? We've got 3 little balloons in the right lung. They all expand on the in-breath. They all inflate, and on the out-breath, they just deflate and release. 2 more breaths. So it's like we've got this endless expansion of our lungs. Okay, we're going to bring arms down by your sides. And just notice your breathing. Does your right lung feel any different in comparison to your left lung? So for me, it just feels easier. I feel like there's more expansion. It's easier to breathe into my right lung, or into this side. And how about if we move the arms up and down? And keep breathing. Just see, does that arm, the side that you worked on, feel any different in comparison to the other side? And how about if we came into a side stretch? So if we stretch the side that you've just been tapping, compared to stretching the other side. And for me, there's a huge difference between the two sides. So that's strange. Just by tapping and just being aware of that side, somehow it just feels, the shoulder feels more relaxed on that side. Easier to breathe. Everything actually, even down to the foot, everything feels a little bit more grounded. It's interesting. Try the same thing on the other side. So just tapping, we're tapping the skin, we're tapping the bones. Can you maybe visualize your ribs on this side? Tapping any subcutaneous tissue. Any fascia, the connective tissue. Can you imagine the lung on this side? You're going to continue tapping. So it's like a pyramid. Our lungs are like two lovely big pyramids that live inside our rib cage. The left lung is a bit smaller than the right. It's got two lobes. And the heart's just nestled in between your two lungs. So we're going to breathe in and inflate the left lung, the two lobes of the left lung. And breathe out just to deflate. We're going to finish by tapping both lungs, both ribs. So can we see all of the lobes of your lungs expanding as you breathe in and just deflating as you breathe out? And there's connective tissue in between the lungs and the ribs. So can you just imagine that this connective tissue is really slippery and slidey and elastic? So the ribs aren't stuck to the lungs, they're kind of, there's like a joint in between the lungs and the ribs, they're free to move. Just another 10 seconds, so the last little flurry to really release the lungs, to really release the ribs. Okay, arms down by your sides, notice how that feels. So how does it feel to breathe? How does your posture feel? How about the alignment of your head, the alignment of your shoulders? Yeah, it feels quite different, a bit more relaxed. Okay, we're going to come to our ribs. We're just going to do another little exercise. Can we just feel our ribs? So I haven't actually got any ribs here. I've just got the sternum and then we've got this cartilage here. But the ribs just continue round. Would be helpful to see, but maybe you can just feel for yourself. Can you just notice there's a little bit of space in between all of your ribs? And then we've got the intercostal muscles in between there, so if you just gently press in, it might feel a little bit tender. So what can you feel? How much of the rib cage on this side can you feel? And can you maybe work out that actually the angle of the ribs is slightly different? So when we're up here, feeling the ribs up here, and there's a rib that comes right up underneath the collarbone, it's a bit more horizontal, that rib. And then as we go down, it's like the angle, 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 angle. So when we get to down here, they're kind of pointing down this way a little bit more. So let's just touch the ribs on this side, your right-hand side, my left-hand side. And let's just see if we can find two ribs, so one above another rib. And just follow them around as far as you can. And then follow them as far back as you can as well. Okay, and then we're going to come maybe just to, I guess, halfway. So we're just down, maybe if you've got a seam on your t-shirt, somewhere around there. So just notice, if you were to come into a side bend away from those ribs, and then you come back up to standing, can you notice that anything happens to your ribs? And maybe if we go the other way. Do the ribs themselves move? Are they just moving as one kind of block? Is the whole thing moving? Or is there a little bit of movement in between the ribs? So I will tell you. So as we side bend away from the ribs, there's more space in between the ribs. And then as we come back, there's a little bit less space. And then as we go towards the ribs, they squeeze together a little bit. Let's try that a couple of times. So as you go away, there's more space in between the ribs. And then we come back, a little bit less space, and then even less space. So you can almost imagine like an accordion. You can almost hear the sound. As you come over to one side, it's like the accordion is stretching. And then as we come back, it's shortening. And then it's coming together. Let's do that again. So coming over to one side, the accordion is opening. And then coming back. Okay. And then can we move just a little bit? So you can improvise, and maybe you can you feel what happens to your ribs as you're moving? So they're all really independent. All of the ribs are independent of the other ribs. So they attach to the spine, but it doesn't mean that they're stuck. They're actually quite elastic because of their shape. So can you imagine on this right-hand side, really, really elastic, mobile ribs? Okay, and then we're going to bring arms down by your sides. Notice your breathing. Notice your posture. So which side do you prefer? Which side feels more relaxed? If you were in a stressful situation, which side do you think would be able to cope better than the other? So for me, definitely this kind of elastic, versatile side. It feels like it would be more versatile if I was in kind of different situations. Let's try the same thing on the other side. So first of all, just finding two ribs. In fact, let's feel more than two ribs. Let's see how low down you can go. So where is the bottom rib? We've got a couple of floating ribs down the bottom. So the other ribs come all the way around and they attach onto the sternum. So they come around and through this cartilage they attach onto the sternum. But down the bottom there's a couple of floating ribs which don't attach. So see if you can just feel those. And then we're going to come back up. So the ribs are huge. They come all the way under here and attach to the sternum, all the way up here, and then all the way around to the back as well. Let's find two ribs. So one above the other. To see how they feel. So for me it's a little bit tender, so I'd like to be doing this one a little bit more. And then can we side bend away from that side, and then we're just going to come back up and then side bend towards the side. So keep your hands there, so on two different ribs. So come up and away, so there's more space in between your ribs. All these intercostal muscles are lengthening, and then a bit less space, and then even less. The intercostal muscles they get a little bit maybe tighter, shorter. So they're going to spring apart as you come over, all those intercostal muscles in the ribs, and they're going to spring back together. So ribs expand, intercostal muscles expand and stretch, and then coming back. Again, expand. And let's just improvise. So can we move the ribs? So can you imagine you've got these really beautiful articulate ribs that can move and stretch in every direction. The lungs are moving, the diaphragm is moving. Okay, and then just coming back up to your standing posture. So we might be still momentarily, but our body doesn't really stay still for any length of time. Just stand and notice. So how does your breathing feel? Does it feel maybe a little bit easier? You've got these elastic ribs, elastic lungs, elastic stretchy diaphragm. How about posture? How about mind? Yeah, thank you very much for watching this video. It's a little bit longer than I anticipated, but so many wonderful things to talk about. Yeah, and I hope this has been helpful, and I'll see you soon. Thank you.